Hi friends, good morning. Happy Friday. We are having breakfast this morning. And why are we having breakfast while I'm filming a video? Because it's gross. Well, we're doing that because we're going to talk about feeding. Actually, we're going to talk about Lily's tongue, which, goes into the whole feeding thing. So Lily likes to lounge while she eats because she has low muscle tone. And we're working on sitting up, but she doesn't like to work on sitting up while she's eating because she's very focused on her eating. So every baby's got their thing. And that's Lily's thing. She likes to lay down. So anyway, Lily's tongue is a large topic of conversation in our house. Because every time she sticks it out, Mommy pushes it back in. And I have done that ever since she was very, very small. It's become a bit of a game now. So the Down syndrome tongue, they do not have oversized tongues. Okay, it's not because it's too big for her mouth. It is, it is, all babies' tongues, I think, are too big for their mouth. But hers, it's because they have low muscle tone. So it makes it very difficult to function the tongue, to make it work properly. And so that's why I push it back in. Because I'm like, nope, put it in. It belongs in your mouth. I have a thing about the tongue. But her tongue is cute. All tongues are cute, I guess, really, on babies. Not on grown-ups. That's gross. But babies' tongues are cute. So anyway, let's talk about the feeding thing, because there's a big problem with the tongue thrust and the feeding. And actually with her, it's tongue thrust with drinking and other low muscle tone in her throat and esophagus. She does not like to drink. She can drink. We've had the swallow test and all that, but she doesn't like it. So we have the G-tube, which is a whole other video. G-tube is awesome. Get one. Every baby should come with a G-tube. That's my little G-tube plug for the morning. I was worried about it too, but if you're worried about a G-tube for your baby, get it. Because, you can put medicine in it. You can put liquid in it when they don't want to drink, like Lily here. So Lily takes all her liquid through the G-tube because she refuses to drink anything, but she takes all of her baby food and big girl food in her mouth, which is amazing. And I know you mamas out there who are struggling with the tongue thrust and the feeding problems, like the babies just spit it back out. They don't want to eat it. You're going, how did you do that? How did you do that? Trial. Yes, she's 8 months old. She did start eating very, very early. All my kids started early. It's the Italian blood, I guess. They wanted to eat very soon in their lives. But Lily probably started eating solidly around 5 months, which is super young, especially for Down syndrome. But we got very lucky. But I really did. It took a good 2 weeks of just every day, sort of three or four times a day, just here, taste this lovely food. Here, taste this lovely food. And it was what we fed her. You can find what your kid likes, and when they're hungry and when they're ready to eat, they can't be too tired. Use the right spoon. All of this advice. There's 80 dozen spoons, and we did find a couple that worked well for us in the beginning. But it's whatever works well for your child, and whatever food they like best. So all that advice is tremendously awesome, and definitely talk to a speech therapist because they're awesome as well. We are very lucky we have Hopkins. Shout out to Hopkins because they're awesome. But here's my best advice for you that I can give, that I am fit to give you, because I'm not a doctor or speech pathologist or GI or any of that. Don't worry. That's my advice. Those 2 words, do not worry. Just don't worry. Let your baby lounge. Let your baby eat when they want to. Let your baby suck their thumb in between, which is disgusting because then it gets on their clothes, but let them do it anyway. It's the little things. Don't worry about the little things. They are like the princess and the pea. These babies can feel it when you're worried. And I promise you, I know you want your baby to be like other babies. You want your baby to be exactly how you wanted your baby to be. No baby's like that. I promise you. It isn't just because we have the Down syndrome child. That's not it. No baby's going to be what you wanted. Not what you want. That sounded terrible. But no baby's going to do what you wanted is the best, because they're all exactly what we wanted, because they're cute and adorable. But they're not going to do what you want at all. They're not going to do what you want because they're going to do what they want. And so don't worry, because they will eat. Someday they will eat. I promise you. And look, she knows I'm right. Okay, so that's my spiel. I'm gonna get off now because she's looking at me like, Mama, it's time. That's 5. There's that tongue. Did you see it? It'll be okay. I promise. Okay. All right. And it's weekend, so it'll be even better. Have a happy Friday, you guys, and a great weekend. And don't forget to click subscribe. And we're going to talk about the t-shirts, Lily's Heart t-shirts. You need to buy one. Get one right now. Okay. Bye. Bye, friends.